Hello, everybody. Chalen Jackson, Compliance Officer and Key Account Specialist with Senior Marketing Specialists. I wanted to come at you with some 2024 changes and kind of an outlook for Part D prescription drug plans. As we know, there's always a lot of turmoil in the market every year, but there's some things going on with the actual Part D program that are likely to have drastic effects on the plans that we offer and the amount of work that you may have to put in this AEP. As we know, the Inflation Reduction Act is making several changes to the Part D program over the next several years. The biggest one that is taking effect in 2024, so this next plan year, is the change to the catastrophic coverage level. Once someone has left the donut hole and entered catastrophic phase of coverage, they will no longer have 5% coinsurance and essentially will have an $8,000 cap on their out-of-pocket spending this year. Once they get out of that catastrophic phase, they will no longer pay coinsurances on any of their drugs. That will be covered by Medicare, by the drug manufacturers, by the plan in combination. And then, of course, more changes in 2025. But we are already seeing the impact of these changes in a pretty significant way. Not long ago, CMS announced the average 2024 monthly bid amount, which is the weighted average of monthly premium bids from Part D plans. Now, this does also include Part D coverage built into Medicare Advantage plans as well as standalone Part D. But that monthly bid amount for 2024 is $64.28, which is nearly double the number from last year at $34.71. So as you can see, some pretty significant changes to the Part D program that could result in drastically increased premiums for beneficiaries. Again, check out sneak peeks and wait until 10/1 to share any specific premium details with your clients on specific plans. But these are all just public numbers from CMS regarding national averages weighted to enrollment. The national base beneficiary premium was set at $34.70 this year. That's the number that we use to calculate late enrollment penalties. And more importantly, and one of the reasons that average bid number is so concerning, it is also the number that we use to calculate which plans are eligible for full subsidy for members receiving low-income subsidy or extra help. So with that average bid amount being so high and, of course, the base beneficiary premium being capped at that 6% under the Inflation Reduction Act, definitely some concerns over which plans clients will have access to if they do have low-income subsidy. So you'll likely have to shop a lot more of those plans this year than you have in years past, and it could drastically impact some of your low-income subsidy clients in terms of the choices that they have for pharmacies, for plans, for formularies, and then if they do have any cost sharing on their LIS plan. You've probably also seen some additional announcements from CMS regarding other metrics that they use to track Part D, such as the average plan premium amount, which is a different calculation that is actually projected to go down this year. But again, taking these two numbers in tandem, they're just calculating different things, and neither of them is a particularly reflective example of what any given client may pay. But the long and the short of it is, between these numbers coming out ahead of time, as well as some of the other market forces at play with PBMs changing for some carriers, some returning to the market after being non-commissionable for the past few years, and just a lot of other general changes in MA and PDP markets, 2024 is going to be the AEP that you really need to shop your clients' drug plans. Definitely makes for a lot of work. Definitely want to be paying attention to getting those updated drug lists and getting scopes of appointment from your clients well in advance of AEP if possible, just to make sure that you can save time during that narrow window of annual enrollment. If you've got questions about which plans are likely to be successful in your given market, questions about how to compliantly and effectively collect those scopes and drug lists and make sure that AEP runs smooth, please make sure you're reaching out to the team here at Senior Marketing Specialists for our best options and advice on those topics.